Disability is now a priority for LBH Makassar. Disability is now a priority issue for Lembaga Bantuan Hukum or LBH Makassar. LBH Makassar is supporting an increasing number of cases involving people with disability, and they are working with provincial DPOs to establish a disability paralegal post. First, the starting point. LBH Makassar became an AIPJ partner in 2013. This was through participation in the provincial level CSO core funding initiative implemented by the Asia Foundation or TAF. Prior to this, LBH Makassar had networked with some of the provincial DPOs and provided some inputs, mainly on supporting drafting of local regulations and laws that apply to people with disability. By their own admission, LBH Makassar's staff had a very limited awareness and understanding about disability. They were motivated to work on disability issues because of concern and empathy for what they viewed to be a vulnerable group of people, rather than seeing people with disability as being rights holders. Second, including disability as a priority area for the organization. What took place? Networking facilitated by the AIPJ CSO, strengthening the program with the national level DPOs, SAPDA and SIGAP took place. The LBH Makassar staff met representatives from SAPDA and SIGAP, and through this interaction, they started to understand more about the rights-based framework for disability. This helped the staff to understand the situation of people with disability from a rights perspective, rather than charitable and welfare model that they had previously used. LBH Makassar allocated some of its core funding from the CSO Strengthening Initiative to help improve their organizational capacity on disability and to engage and mentor more staff about disability rights and how it applies to their own areas of work. Training was provided by SAPDA and SIGAP, and these DPOs also shared information and resources with the staff. In quote, Ibu Purwanti from SIGAP helped us to understand more about people with mental illness and that they too have rights. LBH Makassar staff. Organizational policies and procedures were revised and new ones developed to help promote the inclusion of people with disability within the programs of the LBH. LBH Makassar contributed to more joint action with DPOs. For example, joint advocacy on the regulation for admission to public university, working with local DPOs to help them and their members to be more aware about their own rights. Establishing a disability paralegal post staffed by DPO members who have completed paralegal training facilitated by LBH Jakarta and supported by AIPJ. Working on advocating urban planners and government for a more accessible city, and work in process on a draft regulation at provincial government level to make provision for poor people and people with disability have fair and equitable access to legal and justice services. The AIPJ Provincial Coordinator in South Sulawesi is committed to disability and had previous experience of working with the DPOs. The strategies that are used. Networking with DPOs and other LBH that provided information and offered a way to share ideas and experiences on disability and inclusion. Disability awareness training implemented by representatives of DPOs. Additional core funding that provided resources needed for LBH Makassar to invest in strengthening its own capacity. Joint action and activities with DPOs strengthened mutual understanding and helped build relationship between the organization and strengthen knowledge and experience in disability and rights. Factors that supported positive change. prior interest and experience in disability before becoming of the AIPJ program. Human rights is at the center of the organization, so when disability was framed as human rights issue, it made sense and fitted with the organization's purpose. Strong DPO representatives who could share relevant experience and expertise in a way that encouraged and motivated the LBH staff. Knowledgeable and committed AIPJ staff locally who supported the process and encouraged participating actors in the DPOs and LBH. Provincial leaders and government officials who have shown interest and commitment. Factors that did not support the changes as had been expected or created challenges. Coordination and communication between the provincial DPOs and LBH was not always effective, and there are examples of miscommunication related to planning and implementing some joint activities. The access for people with disability to essential services such as law enforcement, the courts, and other health and education services remains a challenge, and more coordinated mass action is needed. Third, the organizational changes that have occurred. The staff of LBH Makassar has much better capacity to manage cases that involve people with disability, although there is much higher and growing demand which, because of some capacity and resources constraints, is difficult for them to manage. In quote, things have moved very fast and faster than we have expected. We only expected to, in the first phase, build awareness and a new perspective about disability, but we are getting many cases. LBH Makassar staff. Standard operational procedures for disability inclusion in LBH Makassar have been developed and are being implemented, and in the database for case management, disability has been included as one of the indicators. This means that disability disaggregated data of cases referred and managed by the LBH is recorded for civil, criminal, and state administration cases, and for cases related to both victims and perpetrators of crime. LBH, as part of its advocacy work, is raising awareness of other key stakeholders about disability issues and rights of people with disability, including criminals' defense lawyers on the rights of defendants and prisoners with disability, and of community and village leaders. Other changes that LBH Makassar have been associated with. In support of victims who are deaf and have experienced abuse perpetrated by the police because of their communication disability and they do not having official sign language, they cannot easily give evidence. This makes it difficult to have the case heard in court. LBH Makassar has worked with the courts to ensure the judge understands the situation, will admit evidence for the victim even if the interpreter is a family member rather than an official sign language interpreter. Fourth, the key lessons learned, identified by staff of LBH Makassar. Strength is gained through collaboration between DPOs and the mainstream organization, or LBH, as it brings together more knowledge and expertise which helps contribute to progress and success. Framing disability as a rights issue helps make it relevant and a priority for the LBH as it fits with its overall organizational mandates and purpose. Access to supportive tools and information resources on disability helps the mainstream organization build its own capacity. Commitment of senior officials and power holders in local governments and the courts helps progress recognition and support of disability rights and fairer access to services and facilities by people with disability.